Go.
Okay. Lupus is an autoimmune disorder that can affect any part of the body, especially the skin, joints, blood, and kidneys. It causes the body's immune system to attack itself. There is no known cause of lupus, but scientists believe that it may be genetic, with a combination of environmental factors and hormones involved. Lupus has flares when the symptoms become more noticeable. Environmental factors such as sunlight, drugs such as amoxicillin and penicillin, and stress such as surgery or pregnancy may trigger these flares. The hormone is also believed to have the hormone estrogen, which is produced in both sexes, but more heavily in women, is also believed to have some effect on the severity of lupus. There are 4 types of lupus. Systemic lupus is the most common. This is also the kind I tested positive for. Some of the more severe complications of SLE are inflammation of the kidneys, pulmonary hypertension, which is heightened blood pressure in the lungs, inflammation of the nervous system and brain, inflammation of the brain's blood vessels, and hardening of the arteries. Lesser symptoms are skin rashes and joint pain and inflammation. Cutaneous lupus erythematosus is lupus that affects just the skin. It can cause rashes and lesions, but mainly rashes that aren't itchy. Drug-induced lupus is caused by taking certain drugs, but the lupus-like symptoms go away after a few months of not taking the drug. Neonatal lupus is a rare condition that affects babies of mothers born with lupus. It is caused by the mother's immune system attacking the fetus in the womb. It causes skin rashes, liver problems, and low blood cell counts, but these symptoms go away after a few months. Diagnosing lupus can be tricky. Its symptoms often imitate those of other diseases. Doctors must carefully analyze your symptoms, lab test results, and medical history, and the medical history of close family members, because lupus is thought to be genetic and run in families. Lupus can also have a false positive when it's a negative result. Having a recurring Epstein-Barr infection also seems to have an effect on the likelihood of developing lupus. An Epstein-Barr virus is most commonly known as mononucleosis, or mono. That's how I became aware of lupus. I went to the doctor to get my thyroid checked because I had been feeling ridiculously tired, and hypothyroidism runs in my family. I got a phone call a few weeks later from my doctor telling me that the Epstein-Barr test for mono came back positive. So did the ANA test, which detects the amount of anti-nuclear antibodies in the blood. ANAs are found in 97% of people with lupus, but this test can also have false positives, and the results can also change back and forth within the same person. I saw a specialist a few more weeks after that told me I probably didn't have lupus, but it was possible I could develop it in the future. There are also 11 criteria as defined by the American College of Rheumatology to aid in the diagnosis of lupus. They are face rash, discoid rash, sun-related rashes, mouth sores, joint pain and swelling, swelling of the linings around the lungs or heart, kidney disease, neurological disorders, low blood cell counts, positive ANA tests, and other positive blood tests for autoimmune diseases. If 4 symptoms or more are present, you probably have lupus, but doctors can also diagnose if there are less than that. The treatment of lupus depends on the severity, but there are 3 main drugs used. Non-steroidal anti-inflammatory drugs like aspirin and ibuprofen. They reduce swelling. You should check with your doctor beforehand because in some people with lupus, stomach bleeding, kidney problems, and heart problems have been reported. Anti-malarial drugs have also been used to treat lupus, although there is no known link between lupus and malaria. It helps with the symptoms and may also prevent flare-ups. Effects of this drug are vision problems and muscle weakness. Corticosteroids are used to reduce the inflammation of lupus. Side effects are weight gain, easy bruising, osteoporosis, high blood pressure, and increased risk of infection. Lupus can be a very scary thing. Well, it is a very scary thing. But I think it can also be a positive thing. It makes you want to become a healthier person. A good diet and exercise can also keep symptoms at bay. Possibly having lupus was the reason I quit smoking. Really, guys.
Yay!
It scared the hell out of me. I'm really glad I am not thought to have lupus, but I am glad this scary thing happened in my life. It made me want to become healthier and live. The end.